alive. Look at our friends, the Penguins, down at their new home in Moody Gardens, folks.
Welcome back. I want to like dive in.
Do you have pain in your lower back or shoulders that just won't go away?
We have Dr. Binoy Benny with the Spine and Sports Center here to talk about how he's helping treat his patients that have really, a lot of folks are suffering from this, a lot of low back pain, a lot of shoulder pain. But I understand you do try to keep most of your patients out of the big time surgeries.
Absolutely. So thankfully about 80% of people can avoid surgery from any kind of musculoskeletal spine problem. And it's just getting to find out what exactly is going on and come up with the right treatment options.
We were talking a little bit before the show. I remember in high school there were days I slept in a waterbed, embarrassing. But there were days when I literally could not get out of bed. And I've had a number of people, blow a disc or throw their backs out. So describe to us the process of rehabilitating an injury that causes pain like that while at the same time avoiding surgery.
That's fantastic. So I'm actually an interventional spine and sports rehab physician. So I'm all about the rehabilitation, increasing people's function. So when you're talking about back pain, there's many causes of back pain. So people have a strain in their back, but there's a reason that they're having the strain in the back.
And right now we are seeing a little bit of video from your office just showing how things work, but you also have some pretty cool samples here in your hands.
Absolutely.
So what are we looking at?
On the back, is it the low back that takes most of the pressure?
Absolutely. So most of the pressure is taken in the low back. Most pathology in the spine is really from the low back and then on the neck. So you have a lot of these elements in the back. You have the discs, which are these gelatinous type substances that help to support the spine.
Sometimes those kind of slip out on some folks.
Absolutely, and that causes that pain that we call sciatica type pain, that shooting pain that's going down the leg.
So the disc is the cushion.
The disc is the cushion.
So if it starts deteriorating or slipping out, that's where the pain comes in.
Absolutely. So it kind of pushes on these nerves, and that causes the pain that's going down the leg. Most people think when they have that, they're worried, they think they need to have surgery, but 80% of the people can actually resorb, the disc can actually resorb, and the pain resolves.
And Dr. Benny, what are some of the causes of low back pain? Because this, we all sit at desks or computers, we sit in the car in a lot of traffic here in Houston.
Absolutely.
Are those contributors?
Absolutely. So posture is a big thing. We all sit without proper posture.
We just all three sat up really straight.
But this will last for like 10 seconds.
Yeah.
And I'm going to slouch
Absolutely.
again.
And so when I'm talking to patients, I tell them, look at me. This is how you're not supposed to sit. This is how you're supposed to sit. But that's just one of the parts. People can have intrinsic pathology in their spine that's actually causing the problems. There are a lot of joints in the back, the facet joints, the sacroiliac joints, and the disc that can actually cause the back pain. The big thing that I'm about is really trying to figure out what exactly the cause is and educating the patient and letting them know what can they do to prevent that cause from coming back in the future.
Well, and I know for a lot of folks, back pain especially can be the most debilitating thing. It's like all of a sudden one day you're fine and the next day you can't get out of the bed. Yeah. So let's talk about the regenerative, that's easy for me to say.
Regenerative.
Thank you.
There you go.
Cell injections.
You got it.
So a lot of people are interested in resolving the issue, not just kind of treating the pain symptoms, but actually resolving the issue. And until about 4 or 5 years ago, there was no real good treatment. You can have a fusion for people who have what's called discogenic back pain or pain coming from the disc, but it doesn't change the actual morphology of the disc. People with back issues or shoulder issues or knee issues, if you actually want to try and treat and resolve the morphology, you can choose to do stem cell injections, which are actually regenerative injections that can actually re-grow cartilage and re-grow disc tissue that can actually help to heal. So from a long-term perspective, you're not just treating the pain, but you're actually treating what actually is causing the pain.
So that's minimally invasive, a small injection versus back surgery, which is takes months to recover from, by the way.
Yes.
What you guys do is totally different.
Absolutely.
Let's talk a little bit about shoulder pain very quickly, too, because I know we've been focusing a lot about
I'm still trying to sit up
lower
straight.
back. But what are some of the causes of shoulder pain? We're seeing some on the screen right now.
So the most common cause is something called shoulder impingement syndrome, which is a patient comes in, they're not able to raise their hand, or they have pain when they raise their hand up, and it's basically a mechanical cause where your scapular stabilizers are not contracting properly, and it's causing this thing called an impingement. So you're actually, your arm and your shoulders getting knocked together. Initially, that's okay, that just causes some discomfort, but if the person doesn't address that, eventually that can lead to a rotator cuff tear, and that's what we definitely want to avoid.
Oh my gosh.
Well, and I think you're seeing probably a lot of shoulder in your yoga. It's so good for you, but at the same time, if you do the positions incorrectly, you can cause a lot of damage in the shoulders.
Absolutely. So the main thing is really realizing what it is first and treating it aggressively initially with a lot of rehab, or there might be some injections that can be done to decrease that inflammation for the bursitis, and then resorbing that so that you don't end up having a rotator cuff tear.
It sounds like like you're like all about trying to keep you off of that operating table.
Yeah.
Absolutely. But if the person fails those, or if the person actually does need surgery, it's really identifying the problem so that you can lead them to have the right type of surgery.
I actually have a family member who, a doctor wanted to rush her right into back surgery, and after getting a second opinion, the surgery didn't happen, and she's fine now. And you mentioned at the top of this segment that about 80% of your patients avoid surgery entirely, right?
Absolutely. It's going through the rehab, going through the injections, going through that to really find out what's going on and being able to treat them. Really, at least about 80% of people can avoid surgery.
Wow, that is amazing. That's just, 10 years ago, that was not the case.
Absolutely, and with things developing with regenerative injections and all the other kinds, the odds even goes up in terms of avoiding surgery.
So when somebody gets one of those stem cell injections, how quickly do they see the improvements?
Unlike cortisone injections, they're not something that takes place immediately. It really takes about 6 weeks to 3 months because the cells keep on regenerating in the body. So a person can be doing, most people are usually better by about 6 weeks, but they can keep on getting better up to about 3 months.
Wow.
Dr. Benny, we got to leave it there, but we do want to give our viewers the information in case they would like to contact you. The phone number is 713-590-2700. Or if you'd like to book an appointment, you can visit thespineandsportscenter.com. And Dr. Benny, thanks again for stopping by.
So interesting.
Keep up the good work.
Yeah.
Absolutely, thank you.
Coming up next, we're going to announce the Golden Nugget Lake Charles ticket winners for Pat Green and Ronnie Millsap. You don't want to miss that. See you right